Hello, Assalamu alaikum. Good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Okay, today, we've got a program that is, will be very informative, we're hoping, and very helpful to you. And the topic that we're going to discuss today is what to expect when you're expecting. And of course, that comes from a very famous book as well, and a film has been adapted to it as well. But those are the things that are so important, because when a woman, for the first time, especially when she has her first pregnancy, it's going to be really daunting, not just for her, for the family members as well, for her husband, and a new couple who are bringing in a bundle of joy into their life, what they're going to, the different things that are going to come their way. And also for people who have more than one child, it's their second or third pregnancy as well. Each pregnancy is different. So we're very happy to have with us in our studios today our guest, Dr. Tehmeena Rahman, who is an obstetrician and gynecologist and a teacher as well. Dr. Tehmeena, thank you very much for joining us.
Thank you for having me on your show.
Right, okay. So Dr. Tehmeena, the thing is that, especially the first time when a girl will become pregnant, she's usually heard lots of things, going on at home. If she's in a large extended family, she'll have a vague idea of what's going on. But then to sort out the myths from the facts, what should a couple expect on their first visit to the doctor, and what's going to happen?
All right, I'm glad you worded the question, the couple. I always prefer when the couple comes together, not just the lady.
True.
Because the husband has to be part of the process, and he should preferably be there at every visit. And when they come for the first visit, they often have done their pregnancy tests.
Right.
They are generally told to visit as soon as the test is positive.
Okay.
That's not a bad idea, but generally at that time, they're expecting an ultrasound to maybe show a baby jumping around. That doesn't happen so soon.
Right.
So often we're not able to do the ultrasound at that visit, but subsequently, once we know exactly how pregnant they are, then we can schedule the next visit accordingly and guide them from there. But once they come, they should actually be there to ask their basic questions about the do's and don'ts of that time, and listen to the instructions that the doctor gives them.
Okay.
And that's also the start of the process of choosing your doctor.
Right, okay. Now, for many women, we will see that they will come to a gynecologist after they're married, when they get pregnant. How important is it for also young girls to visit a gynecologist before they get married to, rule out any future challenges they may be having?
I wish that was the norm rather than the exception. We would very much like patients to come in for pre-pregnancy counseling. There's an element of intermarriages in our society, congenital abnormalities, for example, thalassemia. These are things that we can screen for. These are things we can test for.
Right.
There are tests now available whereby we can do genetic studies for both the patients and find out what the risk factors are, especially when they're first cousins. So if they come in for prenatal visits before they get pregnant, then we can really take their health to a better level. For example, we can do rubella testing, right? If the patient is not being vaccinated against rubella, we can vaccinate her before she is pregnant. But if we find out that she is not vaccinated, well, when she is pregnant, we can't vaccinate her. And then she's at risk of rubella, and that's German measles.
Right.
If she gets it in the first 3 months, often the fetus is severely affected and we have to terminate the pregnancy. That's how important this visit can be.
Right.
But unfortunately, that doesn't happen.
And it's not something that is so hard to achieve. I mean, all the people who are watching the program right now, this is such important advice that Dr. Tehmeena is giving, that, if your daughter, your sister, or somebody, yourself, you're getting married, you must go and see a doctor just to have, a clear canvas in front of you, because when you want to start a family, you would want to be in the best of health and want to, address any issues as preventive measures. So that's absolutely, great advice there. Dr. Tehmeena, tell us all about, as well about chickenpox and pregnancy, because we hear a lot of, people have children getting chickenpox. So if a woman is pregnant and chickenpox? What is the relationship?
I think all the infectious diseases, depending on the time of gestation, can have varying degrees of effect on the fetus.
Okay.
So if they preferably avoid exposure, that's the first thing that you need to do if someone around you has chickenpox. But then often that's not possible. And if the patient does get infected, there are other viruses as well. So each one has its own protocol. So I think the best thing to do would be to visit your doctor and find out even if someone around you has chickenpox.
Fine.
Go to your doctor, find out the do's and don'ts. If someone has measles, the do's and don'ts. If you have a cat in your house, the do's and don'ts.
Yes, very important. Pets.
Yeah.
Pets
So
as
there's each visit, each patient at each visit, in each pregnancy. There's no set formula. We have to come up with different answers for different patients at different times.
Right.
So the sooner if there's a pre-pregnancy visit, that takes care of a lot of the risk factors.
And that's actually very intelligent, isn't it?
Yeah.
It's not only for yourself as well, you're making the doctor's life easier, your life easier, and also for the future, you're actually started planning seriously for a healthy child.
Absolutely. I tell my patients that the moment you are pregnant, you're a mother. You're responsible.
That's so true.
It's not just when you have the baby in your arms. You're responsible for the baby, even when the baby's not out yet.
Yeah.
So you have to take care of every little bit. Your diet, everything, your physical activity, whatever you may be doing.
Right. Very important point you made there. So, like you said, the minute you're pregnant, you're a mother. Okay. So then the mental sort of the emotional acceptance that now whatever you're doing for two. Yeah. So the diet and weight gain, because we see many young girls concerned, a lot with their weight, with gaining weight. And one of the main questions you'll have in pregnancy is that how much weight am I going to put on? So.
Okay, very important. You are not eating for two.
Okay, all right, you're not eating for two.
Right,
okay, because we've always heard this. Okay.
No, please don't.
Right.
Everyone, they shouldn't.
Okay.
You're actually just supposed to have a few hundred extra calories, and those two of the right kind, more of proteins and the good carbs from veggies and some fruits, not a ton of fruits and juices. You see, that's also sugar. If you have to have fruit, just have the fruit, don't have the juices. It's got to be a balanced diet. You have to watch out for the carbs in the form of roti, chawal, and of course juices and sugar. What happens is that everyone's feeding the patient, telling them to eat for two. They gain a lot of weight. That leads to two problems. The baby becomes fat, difficult delivery for the mom. The mother gains extra weight. Again, that can have a problem at the time of delivery. So the ideal weight gain was about 12 to 15 kilos in the whole of pregnancy, which translates to about half a kilo per week. That does not require a ton of calories. That requires just a few extra calories. The best way to do that, small, frequent meals. Think about, the term mindful eating? When you have some food in front of you, think about it. What do you need to eat at that time? What do you need to have? Do you need all that? Do you need the rice? No. But you need the meat, you need the salad, you need the veggies. Right? Think mindful eating, small frequent meals. And one thing, dates. They are so full of nutrition and vitamins. And there is this myth that garam.
Yeah, definitely.
Right?
Yeah,
that's not the dates.
The eggs, and they'll say that as well. That
too much of anything would cause problems. If you have a whole box of dates, you may face some of those problems. But a couple of dates every few hours would give you iron, multivitamins, nutrition, everything.
Fantastic. Now, that's really important. Okay, the women dealing with, nausea and a lot of nausea, and the morning sickness is actually a sickness that can happen any time of the day or stay with you. So how to tackle that?
All right, the first is to know that it will happen. There's a whole spectrum of morning sickness, starting from very mild to requiring hospitalization and IV fluids and injections. So we start with just counseling, and then the basic tablets dietary advice, again, small frequent meals, don't be empty stomach for too long, the acid buildup.
That will make it worse.
That makes it worse.
Okay.
And then going on to how the extent of treatment then depends on the extent of the vomiting, because when it is severe, it is called hyperemesis gravidarum. That means the patient is not really tolerating anything, and then that she may require hospitalization or frequent visits. So, but all of them, you have to understand, the nausea to the vomiting is part of the spectrum. Most people fall in the middle, but they're outliers. Those who don't have it and those who have it real bad.
Right.
So,
and it's not sort of like, it's not a rule that if you've had it in one pregnancy, you're going to have it in the next.
Not at all. Not at all.
Okay.
But generally, it is better in the next one.
Okay.
The first one is the worst, because I guess the body is exposed to those hormones for the first time. So the first time is the worst, but the subsequent pregnancies, it's less, and the patient maybe learns to deal with it better. One more thing, patients often come complaining of dizziness, chakkar.
Okay.
There's especially in the first trimester, you see in the movies, that's how the pregnancy is diagnosed by the mother-in-law. The patient is dizzy. Yeah, so they come in, all they need is what's happening in the body. The blood pressure keeps falling because the body is changing in the first 3 months. The blood sugar keeps falling. So if they have these small frequent meals, my favorite, and hydration. Right? The hydration goes very bad in the first 3 months because they're feeling sick. So ginger water, little totkas from the grandmother, boil some elaichi, boil and cardamom flavored. So any, little things that may work, but you have to maintain the hydration. So if you're feeling dizzy, have a couple of dates, maybe a glass of lemonade, and put your feet up.
Okay, the rest as well.
And then see, take it from there. Yeah.
What's happening to a woman, you know, when, especially for the first time when she gets pregnant, the hormones that take over, what are they doing to her, and how much does she understand, and how much should she read up about it, and what does the doctor need to tell her?
Okay, she'll be having a lot of physical changes, right? The details are extensive, but let me give you an example.
What about the emotional as well?
Oh, there are lots of those. But in the physical changes, there's just one little thing that when we tell a patient not to wear heels in pregnancy, everyone wonders why we do that. Okay, right?
Please explain the myth.
The progesterone, the hormone of pregnancy, is preparing the patient for delivery. It's loosening all the joints, the back, the ankles. It's not differentiating between the joints. It's loosening all the joints.
And that started at the beginning of pregnancy.
Yes. So what is happening? Wear high heels, you may twist your foot. Normal circumstances, you're fine. But with the loosening of the joints, you tend to injure yourself more, right? The same will happen to your back. So if you need to wear a heel, hold on, walk carefully. Don't let yourself get injured, because the severity would be more.
I think that is such an important, you know, realization, light bulb moment for many people, because many times you're told things, you're not told the reason why, so you know, you really don't know what's going on. That's such a valuable
These
information.
Are little snippets. So coming to the emotional thing, a woman has all these surging hormones, right?
Poor husbands, they have to.
Poor husbands, they need to just back off.
Okay.
I tell the patients when the couple comes, I tell the husband, just think that your wife is right. Right. You're wrong.
That's it.
And that's it.
That's the rule of 9 months.
You want to get through this?
Okay.
just be there for her and let her tell you what to do, not to do, but do not argue, do not question. And if there's anything, ask me. But do not, you know, tell her.
Enter into a direct confrontation. You have to be very tactful.
Very tactful. The worst thing you can say is, everyone's pregnant. Why are you having this problem? The worst but these are the things that happen. This is man is a social animal. You see other people around you. And everyone's pregnancy.
I think we needed a really important program for you, you know, addressing the husbands as well.
I think there should be a separate.
We'll have a separate segment for their counselling.
Their counselling would start from the time they get married.
Right.
There's a lot that they need to do, and they
right.
need to understand.
Right.
And understanding that a woman is going through so many changes. She's going to become a mother, but especially the first timer. She's got so much going on in her body and she's confused. She needs to be just held close, cared for, nurtured.
Understood.
Yes.
Yeah.
And don't make that about, you know, everyone's giving birth, what's the big deal? For
Yeah.
that woman, that child.
Oh,
and when we say,
very hard journey.
Yes. And when we say, remember we talked about the mother, the patient is a mother from the time she gets pregnant.
Yeah.
So just to touch on miscarriages,
Right.
the trauma of losing a child even in the first trimester is very severe on the mother.
That's true.
And the physical effects are also very severe. I tell the whole family, please don't think that because she's not bringing a baby home, that she hasn't gone through a lot.
She hasn't gone through grief.
Not just grief, the physical changes. The grief is there because there's nothing to help her through those physical changes. She doesn't have a baby in her arms to carry her through those physical changes. But she actually has lost something. And thinking that this was just a couple of months, she was still a mother.
Of course, that's absolutely true.
For her, the emotional journey was still the same.
Now you mentioned miscarriages. What exactly is it, and how do we define? Is it only something that happens when you lose a pregnancy during the first 3 months, the first trimester, and what are the reasons? And then does it become a recurrent factor?
All right. First, the definition. When babies won't survive till 28 weeks of pregnancy, before that was a miscarriage, then 24 weeks, 22 weeks. It's the age of viability.
Okay.
So generally 22 weeks, 24 weeks, different definitions, different areas. That any pregnancy loss before that is a miscarriage, right? Even the second trimester ones, right? The recurrent miscarriage is when there's consecutive loss of 3 pregnancies.
Okay.
That's when we define recurrent.
Right.
Most people are pretty traumatized by their second loss, right?
Definitely.
They want answers.
Yes.
One answer that we didn't have previously, which we have now, when the pregnancy is lost, the products of conception, what comes out, even whether it's a DNC or something, we didn't have tests for that. Now we do.
Okay.
We can send it for DNA testing, right?
Okay, right.
So initially that used to only be done in research settings, but now we can offer it in clinical settings. It's still very expensive, but if someone's that traumatized and they want answers, then we can offer it.
And they have the resources.
Then we plan for it. That if they get pregnant the 3rd or the 4th time and they lose again, then we can offer that test. At least now we have an avenue for more answers.
Investigation.
Which we didn't have before.
Right.
There are a ton of other tests, and that's again a whole other show.
Right. Okay. Okay.
But we are not able to have all the answers. Unfortunately, it's not that the issues may not be there. Medical science has not yet reached that point.
Right, okay. So if a woman has had a miscarriage in her first pregnancy and she gets pregnant again, what should she be doing? Should she be altering anything? Should she be more careful? What is the sort of
The commonest reason for one, or let's say the first miscarriage, is a genetic issue.
Okay.
If the husband and wife are not cousins, it most likely will not happen again.
Okay.
Right?
Okay.
So my advice generally is just treat the second pregnancy as a normal, regular pregnancy. Don't be over cautious. Don't be over vigilant, right? Because if that was the reason, which is like in 1/3 of the pregnancies at least, that's the reason.
That's a high statistic, yeah.
That is high. Yeah. So that means that there's just 30% possibility that it can happen again.
Right.
Which is not as much, right? They need to just treat it as a normal pregnancy.
Okay.
Visit their doctor normally. Yes, if it happens again the second time, then before the 3rd pregnancy, have a plan.
Okay.
Not necessarily all the investigations, because that started after a 3rd loss.
Okay.
But you can have a plan with your doctor for the 3rd time. But don't freak out the second time around. There's not a huge...
Don't get too anxious about it.
No.
Don't sort of like, you know, get obsessed with it.
Yes, if there's one miscarriage, I tell my patients to, in fact, offer a prayer of thanks, because they actually, there's a great possibility that was an abnormality, and Allah has protected them from that, right? So instead of being upset and disturbed, be grateful.
Right, absolutely. Okay. Now let's talk about, you know, something that we hear a lot of people saying, and you know, if you do a comparison to about 20, let's say about 20, 25 years ago, and now, it seemed like about 20, 25, 30 years ago, more women were having normal deliveries, as opposed to nowadays when you see, you know, you hear about nearly every other young woman having a cesarean. Now, what's the science behind that, and what's going on?
All right. You've asked that question. Let me ask you something. What do you think is going on? What is the common perception? What is going on?
The common perception that people have is that, you know, doctors are favouring a cesarean rather than sticking it out with a long, you know, with a waiting for a normal delivery. Yeah.
I think in a lot of cases that unfortunately may be true. It is very easy to technically difficult, but you're trained for it, so it's easy to do.
And sorry, I forgot as well. Many people say that there's the financial factor as well.
Yeah. In the financial factor, let me point something out. In most of the setups now, the surgeon, the obstetrician, gets the same fee or similar fee whether she conducts a normal delivery or a cesarean. In one, there's a lot of time. In the other, a lot of skill. Right. So eventually, we mostly come to the conclusion that our fee remains the same. So there's no financial benefit, really. Right. So especially in the private sector. I think it's more to do with time and convenience if there is a doctor's angle. Right? We're just covering that for now, but I'll come to the other side of the picture. The financial angle aside, the time. It's very quick it takes half an hour to do a cesarean. We've done hundreds and we're very skilled in that. Labor, unpredictable. You don't know how long it'll take. You don't know even till the last moment what the outcome will be, right? So leaving that aside, there are lots of things patients can do to improve their chances. Starts with choosing the right doctor, having a relationship of trust. Yes. They have to be able to, whatever trust issues or questions they have to be addressed while they are doing their prenatal visits. Once they are at the hospital for delivery, they should have so much trust that they let the doctor do their job. There are so many times that the family is harassing the staff to such an extent that their decision making is affected. Right.
So, you know, like you said, the patient has a responsibility as well, the family as well. What should, you know, if a woman is having healthy pregnancy, normal pregnancy that is progressing normally, what should she be doing before her delivery? What do you advise? And what about those myths that go around, you know?
For example?
For example, you know, to eat something or take something that will help you, or whatever.
Slide. All right, coming back, you've chosen the doctor. You're listening, you're going for your regular visits, right? And then you make sure your diet is correct. The patient has to not gain too much weight. Her activity level has to be optimum. She doesn't start an activity she's never done before, except maybe swimming and walking are two things that even if she's not done before, doing these two will help.
Walking is something that's you don't have an excuse for that one.
No, you don't.
Okay.
No, you don't. And see, the women in those cultures where they squat a lot, where they sit on the ground, tend to pop the babies. Right?
True.
Our lifestyles have contributed to it. Sitting on the chairs, not really moving around, not exercising, the pelvis doesn't open. Right? So that's one side. Then the patient also has to be ready to tolerate the discomfort and the pain. Of course, we have epidurals for the pain now, but she has to be willing to take some degree of pain. I have had patients come to my office and request a cesarean and request that please don't tell the family that I've requested. Make an excuse for me.
Oh dear, because they don't want to go through the pain of labour.
Or the unpredictability.
Okay.
Lots of people schedule because of convenience. There are lots of cesareans, their indication is patient's choice. That is increasingly in demand.
Okay.
They don't. They're working women. They celebrities. They want scheduled deliveries. They don't want the unpredictability of rushing to the hospital middle of the night.
Okay.
Right. So there is a contribution, a lot of contribution from the patients. And then once you're trusting the doctor, you have to trust till the last moment.
Yes.
The doctor may need to do an emergency cesarean in the end, but you have to understand that it will only be done if the mother
your interest
or
and
the
the child's interest.
Yes.
Okay. Now, let's talk about after the delivery. It sort of happens in our culture that everyone will become really, really, you know, proactive at that time. And you'll have all these things being sent over to your house, and the new mother is pampered a lot, and you know, she'll be told to have lots of rest, not get off the bed, and people, you know, coming over to massage her or whatever, and then she'll get all this ghee and asli ghee and whatnot and things to, you know, to eat, and panjiri and things like that. Now, how much of that is good for her? Where is the balance? What actually should she be doing?
All right. Two sides to this: the physical activity and the diet. Chilla, the 6 weeks postpartum, the 6 weeks after every surgery or procedure or trauma to the body is the healing cycle of the body. It's 6 weeks is a regular healing cycle of the body.
Okay, so those 40 days are actually
very important.
Very important for any sort of surgery or even, okay, that's very interesting.
Hikmat recognized it for centuries. Allopathy actually took longer to recognize it, right? The healing cycle is important. The rest is important. The massage is important because all the hormonal changes are now being reversed.
Right. So all those loosening up of all those joints and everything is now slowly coming back.
Yes. Okay. The massage works. The rest is important. You actually recover the most when you're sleeping, even after surgery or injury or anything, right? So the massage is important, the rest is important, not lifting heavy weights is important, and immunity is low. So not interacting with a lot of people is important.
Very important point you've made there. And also for the baby.
Oh my God, I cannot even stress that. Everyone wants to come and hold the baby and kiss the baby and infect the baby.
I heard, I read an article where a newborn baby died because she was kissed by somebody who had the herpes virus.
Yes, yes. I tell my patients, put the baby in a crib,
okay,
so that everyone can see the baby, but in another room. Say visitors sit in another room.
Right.
Bring them in, see the baby. No one picks up the baby; they go out. But
how do you achieve that balance in a culture such as ours?
Lot of difficulty. It's very difficult, but you have to put your foot down. You have to put your foot down. Now coming to the Panjir thing, again that's hikmat based. It has, we are talking about the reversal of the hormonal changes, right? Tamarkas. There are so many ingredients there that help the woman's body come back into shape, the abdominal muscles, the perineal muscles, the back. I mean, these things are amazing. Just put less of ghee maybe, because the lifestyle does not have so much activity or before or after. Because our women, the modern woman, is not going to go back to the fields after 6 weeks. She's maybe going back to an office and a very sedentary lifestyle. So that she doesn't need all that ghee.
It's going to be harder for her to burn off. Because she's got the baby weight as well, and then adding to the asli ghee and everything would be a problem for her. Okay, let's talk about Googling the patients that come to a doctor after they've extensively Googled. What are the tips there?
I actually think of Google. There used to be puppies and tais and neighbors and masis and khalas. Google is the modern puppy and khala.
I like that.
So I'm not. It's not wrong to search, just as it's not wrong to take people's advice. But everyone, even if your family is telling you something, you have to have the sense to sort it, to understand who's the sensible one, whose advice you can take on board and bring to your doctor. And
before you go and freak out your doctor with grace.
And this is another thing. people love freaking out new mom to be.
Oh, that's true.
They love telling them horror
horrible,
stories.
yes.
Please stop. They are going through enough.
Yeah.
And Google adds to it. They should go to reliable sites, but not to the forums.
Right.
The forums are full of people, and you know the complainants are always louder. All the people with happy experiences are quietly sitting happy at home.
That is so true. That
But
is
the
such an important point.
Yes, the forums are full of the complainants, the negative experiences, which are often just a minority. Don't go to the forums. Go to good, reliable sites. In fact, ask your doctor.
Yeah, for more information, where should I?
Yes.
Yeah, that's a very good
My
point.
patients, I love it when they come after Googling. Makes my job easier. My patients are in touch with me on WhatsApp and everything, and I think it's a mutual exchange of information. I tell them a lot because of my background knowledge, but then they are studying only their one disease. I learn a lot from them.
That's fantastic.
They go on to new links and research and all. So if you are actually doing things sensibly, you're helping your doctor.
That's so important.
And doctors, I believe, and that's my advice to my friends, that please don't be intimidated or irritated by a patient coming with Google
That's
questions.
also very important.
It's fine. That's today's puppy, Chachi, and they have every right to do that.
Right.
So we don't need to worry about it, but just everyone's got to be sensible about it.
A question here is that if a woman has had a cesarean, number one, how long does she have to wait till the next pregnancy? And will that be a cesarean or can it be a normal delivery? What's the facts here?
So I'm assuming that we're talking about a first cesarean, right? Because if a woman has had 2 cesareans, the third will have to be a cesarean.
Okay,
right?
if you've had 2.
Yeah. So after a first cesarean, there is a potential for a normal delivery with certain criteria.
Okay.
The reason for the cesarean has to be a non-recurrent one. For example, if someone has a cesarean because she has a very narrow pelvis, that's not going to change.
Okay.
She will require further cesareans.
Right.
But if it was for any other reason, like baby's distress or something, then she could possibly have a normal delivery the next time around, right?
Okay.
Then the interval. She should plan her next pregnancy after a year. If the next pregnancy happens too soon, and if the delivery date is say in a year or a year and a half, it's like the uterus has started expanding too soon.
Okay.
The area is still not as healed and strong.
Right.
So the trauma of labor pains may not be maybe too much for that area.
Okay.
And the risk is of rupture.
Okay.
Right? So we have to, whenever a patient comes in wishing for a cesarean, normal delivery after cesarean, we have to look at the reason, the interval, and then the current situation, right? She has to come in natural labor. We can't give her artificial pains.
Okay.
If she comes in natural labor, has good progress, and we are seeing that there's no risk of rupture, we can give her time. And we have delivered lots of women normally after a cesarean.
Right.
But with strict criteria, strict vigilance.
So it's different to every case,
Yes.
but that's the reasons that you will progress with a normal delivery or a cesarean. Yeah. Okay. Now, diabetes and blood pressure during pregnancy.
Okay.
If you've had blood pressure in one pregnancy, are you going to have it in the next? And what if it continues after the pregnancy? What's going on
All right.
here?
You see, every visit the patient comes, we are checking her blood pressure. That's how important it is to us, right?
Right.
It's not just how much the blood pressure is, it's the rise of the blood pressure, which comes with its risks of so many complications, right? So there are those with pre-existing high blood pressure who have further rise in pregnancy. The risks are different. Those with normal blood pressure and having specific to pregnancy increase in blood pressure, their risks and events are different.
Okay.
And having it in subsequent pregnancy also depends on the reason for the first time. So each patient has to be evaluated and given counseling for the next pregnancy. Right? But of course the risk, it is so important to us, and it is something that we can detect early, manage early. So if the blood pressure is kept a check on and we pick it up early on, that there's a rise beginning, then we can offer treatment modalities to mitigate the risks.
Right.
As far as blood sugar is concerned, the screening for sugar starts with the history, the family history, the patient's personal history, previous babies, previous pregnancy histories. Once we have the history, that's the first screening, then the tests, the blood tests, those are the second tier of screening. And then depending on the risk factors, we could manage with diet alone, and just lifestyle changes, Shabnam. Our problem is that our lifestyles have made a lot of things very difficult for patients. The lifestyle choices, even the sleep cycle,
that we can easily change.
A lot is in our hands. And obesity, starting with obesity, already increases the risk of high blood pressure and diabetes. Right. So healthier lifestyles, the prenatal visit, which we spoke of, that she should actually come before she is pregnant.
So true. That would be an ideal situation.
Be in optimum health.
Another thing that I wanted to touch upon, the responsibility of the family members, especially the female family members, in offering emotional support and advice to a young mother, especially for the first time during her pregnancy, and to be very, very mindful of what you are saying in front of her. If somebody has had a bad experience, keep it to yourself. And do not terrorize her.
Yes.
Tell us about that.
You see, those people who are fortunate enough to be amongst joint families and having relatives around are actually very fortunate. It's just a few women who thrive, few family members who thrive on scaring the new mothers to be. Most of the people...
Maybe they're doing it subconsciously as well. They're not really...
I hope so.
They're not really paying attention to the fact that, you know...
I don't know. I think they get some joy out of it or something. I hope not. Right. But still, most of the advice is good advice, and most of the people are very encouraging and supportive and tell the girls about their good experiences as well. I think in the West, the girls are a little unfortunate. Then they must attend the classes that would prepare them, because they need the support, right? And they need the good stories, the encouragement.
Right. So, you know, what should women be sort of, you know, what sort of an environment should they be promoting at home? The family members, especially, you know, the aunts, the mother, the sisters.
Nurturing, loving, lots of TLC.
I feel that we start to criticize a bit more and start to be a bit more, you know?
Exactly, that's why I'm stressing again and again, lots of love, lots of care.
Especially if there's a daughter involved, you'll be, because you're being protective, maybe that's the reason behind it. You're a bit harder on her. You don't do this, don't do this. Oh, you're not looking after yourself. You're not doing this. You're not doing.
But still comes from a nurturing perspective, I guess. The
But
scolding.
it's not going to be perceived as a nurturing, is it?
There has to be a balance, just as in everything else. I mean, of course, we would never encourage a woman to lift a heavy weight in pregnancy, right? So, but being so careful that she's not allowed to touch anything.
That also is not good for her.
Not good. The balance is there. But I think when everything is being done in good faith, the girls are very sensitive at that stage. So they should enjoy the pampering rather than just go with the flow.
And sort of understand that who's coming from what angle, you know. And sometimes a person is so concerned that they'll actually maybe be harsher a bit or be a bit more, you know,
or overly caring, irritatingly caring. Most
caring.
An educated girl who's read something entirely different online is told by an elder in the family to do something else. When they come and ask me, I tell them, if it's going to harm you, listen to them. Ask me, I'll tell you if it's harmful.
Absolutely.
But if they're asking you to lie down, do this, not do this.
They're doing it because they care.
Yes, if it's not harming you,
absolutely.
then just listen to them and enjoy your time.
Right. Dr. Tehmeena Rehman, thank you so much for being with us here today on today's program. So much to talk about, and you know, unfortunately running out of time, but the advice you've given is really, really important. We've been able to discuss all the nitty-gritty and all those things that many people have been confused about. We will be having you on the show again, where we will talk about the health challenges of a modern woman. But until then, thank you so much for being today's guest.
Thank you. Thank you.
Okay, and with that we come to the end of today's program. Hope you have really, you know, got a lot of knowledge there and information from Dr. Tehmeena and all the advice that she had to give. So, you know, be mindful about pregnancy. Best thing is to actually see a doctor and before you get pregnant, and that will really, you know, make your chances of having a healthy baby and a healthy yourself as well, the healthy mum to be, that will make them so much greater. So until next week, stay happy, stay healthy, bye bye.